Canadians often get frustrated at politicians that simply call things out and then don't do anything afterwards. So I think Canadians will expect concrete answers, concrete measures.
It's an all too familiar story with many Indigenous people. You're just not safe in the Canadian healthcare system. The latest example? In Alberta, accusations of an Ojibwe woman's pleas for more oxygen went ignored. Miller was asked in a press conference Wednesday if federal funds could be withheld from provinces who do not address racism in healthcare.
This is not a time to be holding back money as a threat, particularly during a pandemic. This is a jurisdiction that is jealously guarded by provinces. But when it comes to issues like racism, systemic racism, discrimination, every leader in this country has a leadership role to play in calling it out and getting rid of it.
Quebec officials, like Indigenous Affairs Minister Ian Lafreniere, have yet to recognize systemic racism exists in their province.
But we agree to disagree on the systemic approach.
Lorraine Whitman of the Native Women's Association of Canada says incidents like Joyce Echaquan's, where the Atikamekw woman live-streamed racist comments from healthcare workers shortly before she died, says it all when it comes to systemic racism in the healthcare system.
You know, when you see a video and it's already there and you see the systemic racism that's there, I'm sorry, but in order for anything to be corrected or to be moved forward, you first have to admit there is a problem, and we know there's a problem.
Whitman says Native women need to be front and center over the next 2 days of meetings, and is dismayed that her allotment to speak is only 5 minutes.
Yeah, so I do feel that, you know, hearing the voices from an Indigenous woman lens to this issue is so important that the women's voices be heard.
Many agree that doing nothing with regards to systemic racism will have fatal consequences. Jamie Pashagumskam, APTN National News, Ottawa.